Hello, I am Dr. G.K. Prusty, neurosurgeon from Calcutta Medical Research Institute, Calcutta. On this event of Purple Day, I want to give some information for people those who are interested to know about epilepsy. Epilepsy is not a new disease. This epilepsy has been described in the ancient literature of our country. 3000 years ago, people have described about epilepsy in the Ayurveda. And epilepsy is not a disease that only affects people who are not successful in life. People like Julius Caesar had this disease, and this disease is treatable. Now question comes, what is epilepsy? Our brain is made of some specialized neurons. Each neuron of our brain is like a electrical cell, and they discharge electrical current. Our entire activity of the body, human, is controlled by the brain. Now some of these cells can discharge current abnormally, so that the whole body gets affected. If that abnormal electrical discharge is not controlled, then it manifests in different way. Because as I told you, our brain controls all parts of our activities, our joy, our happiness, body movement, everything comes from the brain. Now when these cells are acting abnormally, these aspects of our life is getting affected. So if it happens once, then it is called a seizure. But for calling it epilepsy, this kind of attack has to be repeated. Now question comes, what are the different types of epilepsy? As I told, depending on the part of the brain affected, the epilepsy are of different types. Sometimes epilepsy can manifest like abnormal behavior, sometimes just is transient loss of consciousness. Sometimes somebody may throw a tonic-clonic jerky movement of the body. So these are the various type of epilepsy that one can happen. In some epilepsy, any epilepsy rather I would say, it has got a 3 phases. The phase 1 is the phase or initial phase where somebody may experience some abnormal things, maybe mild headache, or some lighting inside the eye, or some hearing. This is called aura. Followed by this, there is a middle phase when the patient, that's a real epileptic attack. Somebody may be confused, somebody may suddenly fall down, somebody may have a jerky movement, somebody may talk abnormally, somebody may have eye rolling, somebody may have smacking movement of the lips, or maybe inability to move. Somebody can have a racing heart, suddenly the heart rate will go high. Somebody may have got difficulty breathing, clenching of the teeth, and some people may lose their consciousness, throwing and throw. On the symptoms can range from simple staring or eyelid fluttering or non-responsiveness. Abnormal movement of the tongue also can be noted. In the end phase, this phase may last for 5 to 7 minutes. Then when patients may have memory loss, depression of sadness, difficulty in talking, exertion or weakness, these are the various things one may experience. And after this epileptic attack, one may remain in this confusion stage or state of headache for about an hour or so. So this phase one should not leave the patient and go away. Now what are the causes of this epilepsy? The cause of epilepsy can be different at different ages. What is true is that in the younger age group, there may not be any cause of epilepsy. Whereas people, in the elderly people who are after 60, there can be some causes of epilepsy. But the one thing is that patients with idiopathic epilepsy, where we do not know the cause of epilepsy. But what are the possible causes which you know that why epilepsy is occurring? These causes could be a bleeding inside the brain, any abnormal blood vessels in the brain, or any brain tumor, or any infection of the brain, or a stroke, HIV, Alzheimer's disease, or family history of epilepsy. These are the various causes of epilepsy. In children, there is a seizure called febrile convulsion. When the temperature goes more than 101 degree, these children, the brain cells, they may behave abnormally, discharge abnormal electricity. At that stage, children may have jerky movement. These are not epilepsy. They may be self-limiting. So during this phase, children to be treated with sponging or how to do the bring down with medicines which can bring down the temperature. People who have got a family history of febrile convulsion, in these cases, subsequent life, the risk of epilepsy is more. What are the various trigger factors that can induce epilepsy? One is somebody forgets the medicine, increased stress, lack of sleep, menstruation. Some women can have epilepsy during the menstrual cycle. And as I have already told you, fever is a triggering factor. Use of alcohol and caffeine is another triggering factor for epilepsy. Some people have also got epilepsy with flashing of light, like watching TV or the flickering light of the tube light. Sometimes the geometrical patterns can induce epilepsy in some of the patients. How can we diagnose epilepsy? Epilepsy diagnosis is important, where the doctor will take the history. What happens before epilepsy, how it happens, how it ends. These are the history, very important, and so from this the doctor will know what are the type of epilepsy one is suffering from. Besides this, we will have tests like EEG, which show the electrical activity of the brain. Like we do ECG, similarly we do a EEG to see the electrical activity of the brain, which can detect the site of epilepsy or from which part of the brain it is coming. Sometimes you can also detect other causes of brain diseases from this EEG. With CT scan and brain MRI, nowadays we are able to locate the various lesions in the brain or pinpoint which exact area these epileptic activities or triggering activities of the neuronal cells and triggering for the epileptic attack. How is epilepsy treated? The main treatment for epilepsy is medicine, and in rare cases where they do not respond to medical therapy, then the patients may require surgical intervention. As I have told you, some patients, 80% of the patients can be treated effectively with control of seizure with anti-epileptic medicines. Epilepsy should be treated like a disease, like one has hypertension, one has diabetes. Similarly, it is a disease where one can treat the patients with medicine. In rare cases where you have diagnosed a lesion, a pathology inside the brain, those cases patients may need surgery, and in these cases a thorough investigation is done and we pinpoint which part of the brain is abnormal, which is sending abnormal electrical activity. Most of the cases we see this in the temporal lobe, and patient may have got a medial temporal sclerosis. Such cases with microsurgery, that epileptic focus or the cells which are abnormally sending electrical discharge, this part is excised and patient may become seizure free. After surgery, it is not necessary that patient will be without medicine. In most cases, they will need surgery for several more years. It is only when patient has got uncontrolled seizure, after adequate treatment with medical therapy, then only one subjects them for any surgical intervention. How long one needs to be treated with anti-epileptic medicines? Is it lifelong? No, not necessarily that the treatment will be lifelong. Suppose after regular therapy one does not get any seizure for a period of more than 1 year, then the doctor may consider to reduce the drugs. In some cases, the medicines may be taken for several years, and in rare cases, one may have to take medicines lifetime. The question comes, can epilepsy be cured? I have already answered this question, like asthma or diabetes, hypertension. Epilepsy is a disease which has to be treated. It is not necessarily that every patient can be cured, but they can be treated. There are some misconceptions or myths about epilepsy. That is epilepsy a rare disorder? It is not. It affects about one patient with every 100 population. About 50 million people are there in worldwide. In a country like ours, there must be around 6 to 10 million people who are suffering from epilepsy. Are people with epilepsy mentally ill? No, they are not. Epilepsy is not a mental disorder. It is a disorder of the brain which sends abnormal electrical discharge. Are people with epilepsy violent or crazy? No, they are not. They are like all other people, but during the attack, this can be a post-ictal phenomena in some cases. Some children, because of the attack, they feel embarrassed sometimes, and because of the recurrent attacks, they may react differently in the school, and they are treated as abnormal children. For this, the teachers must be careful, and the children should be given special attention. Are children with epilepsy dull? No, they are not. They are like any other children. Is epilepsy a curse of God? No, it is not a curse of God. Anybody can get epilepsy, as I have told you. And does epilepsy spread touching or coughing? No, it's not a disease which spreads by touching or coughing or by staying with the patient. Some people give you onions, metals, and sometimes shoes to the patient. Please do not do this, because this really does not help. Are epilepsy medications are ineffective? No. Nowadays there are special medications and advanced medicines have come up which helps for better control of epilepsy. In case of women, is marriage a cure for epilepsy? No, this is a myth. But epileptics can marry and they can have normal children and they can have normal marital life. Is the life of the person with epilepsy miserable? No, I disagree with this issue. Epileptics can lead a normal life. As I have told you, Julius Caesar, such a great warrior, had epilepsy. Epileptic patients may have some restrictions in life, like not going into water alone for swimming, or going near fire alone, or driving a car. Otherwise, they are like any other people. They are normal. They have to adjust their lifestyle depending on the need. And particularly, I would not suggest epileptic to work near a machine, but definitely with the assistance of people, they can perform all kind of work. So, as I told, epilepsy is not a hindrance for leading a happy and successful life. Lastly, I want to give you some tips about do's and don'ts of epilepsy. Do take the medicines prescribed regularly. Do make it known to the family members. Don't keep it secret. Even in the school, the teachers must be known. They must be also explained to your neighbors or friends or colleagues that you have this attack and what to do when such an attack is there. One must have a regulated life and balanced life to have a better control of the epileptic fits. Do not stop your treatment without asking your doctor. Don't consume alcohol or caffeine, as I have told you. Please do take medicines regularly. I am emphasizing it repeatedly. When you are going to the bathroom, try to avoid, if possible, locking the door from inside. Do not smoke and do not give your medicine to others. Hot first aid can be given during epilepsy. When one understands that he is going to get an attack, that is something like that, a staring, a confusion, darkening, twitching of the face. As soon as these symptoms these signs or symptoms somebody sees, it's better to make the patient lie down or sit down, protect his head when an attack. If possible, give some soft cushion-like thing under the head so that the head doesn't break. Don't give any water or anything in the mouth, any cloth or any metal. He might have a tongue bite, but you cannot stop it. Make him lie down, preferably in the lateral position, so that the saliva comes out. This entire episode should settle in 5 to 7 minutes, and following the attack he should be kept in the lateral position and the side position, and should not leave him for next 1 hour until he becomes totally normal. Just because patient has become conscious, that doesn't mean that he has become normal. Keep him in a safe place. See that his head or body is not injured during this phase of unconsciousness or movement. And you must not panic when somebody gets an attack. If this attack lasts for longer, please seek a medical help. Thank you very much.